Well, thank you, Devin. According to the VA's Department of Women's Health states, about 60% of people with a thyroid condition are unaware, but it's actually a common issue among women.
And here to tell you what to watch out for is Nurse Christina Paris. Thanks for joining us this morning.
Good morning. Glad to be here.
Yeah, you made it in before the storm.
I did. I know. Not looking forward to it this afternoon. But
I'm sure we'll be all right here. You know, we'll bundle up, but we'll move right along here into today's health topics. What is thyroid disease? How are they differentiated?
Yeah, absolutely. So the thyroid is a butterfly-shaped organ that's right here in the front of your throat. And it's really important because it releases thyroid hormone, which is really critical in muscle development and in organ functions properly. And it aids in heart and digestion, muscle control, even metabolism, mood. So it's a really critical chemical and organ that we need.
And so maybe are there kind of some common symptoms that people can look out for to help identify, you know, if they have thyroid disease, or maybe distinguish between?
Yeah, absolutely. So when we, it's something that releases a hormone. So it either, a disorder would mean it's not functioning properly. So it's either releasing too much TSH or thyroid stimulating hormone or not enough. And so with hypothyroidism, that would mean it's not producing enough. So your body's gonna kind of slow down. So you're gonna see signs like poor metabolism. And
so that's if it's not producing enough.
Correct, yep. You're gonna feel cold because it does aid in temperature regulation. You might have hair loss, thinning, puffy face, drier skin, a slower heartbeat. You can have joint and muscle pain. Weight gain is one of the big ones. Women will often go in and say, you know what, I've gained all this weight, I don't know why, I can't lose it. Again, because it slows down the body systems, you might have constipation, depression, fatigue, things like that. So that's hypothyroidism. Now, hyperthyroidism, meaning it makes too much of the hormone. So things are going to speed up since it's more a metabolism thing. So you might have an increase in the heart rate. You might feel hot, increased sweating, eye irritation or bulging, rapid heart rate, muscle weakness. You might have unexplained weight loss, diarrhea, lighter periods, anxiety, trouble sleeping. So those things can occur when you have too much.
So like polar opposites.
Right, like correct. And you can also have disorders, you can get cancer in your thyroid and have nodules. So there are other things that can go on with the thyroid.
Well, yeah, definitely something to, be aware of and pay attention to, but how is it treated? Can it be treated? It can,
yep, absolutely. So they're gonna run some tests. They're gonna check your thyroid, your different thyroid levels. So T4. T4 is really important because it is what sends a message to your brain saying, hey, I need more thyroid stimulating hormone. So if it's not working properly, it's gonna keep sending this T4 and you're gonna have this increase of TSH in your blood. That means that it's not using the thyroid hormone like it should. So we will check a TSH as well. And if your TSH is elevated, we give you Synthroid, which is a synthetic thyroid hormone. Your body doesn't care, like with diabetes, a sugar is a sugar is a sugar, whether it's from fruit or candy, same. So if your body if it uses a synthetic hormone, Synthroid, it helps to produce. So we're gonna do tests. We're gonna check all the thyroid levels and give medication depending on the cause, whether it's hyper or hypo.
Right, and so, when it comes to kind of thyroid disease, we sort of mentioned at the beginning, it happens a lot to women. That's typically who you tend to think of when you think of thyroid disease, but how often can men have some sort of
absolutely. Issue? It can affect men as well. I think maybe women are more sensitive to the symptoms. Maybe that's why we go in, but absolutely, men can be affected too. So it's something that if you're having any of those symptoms, you want to go in and talk to your doctor and get a blood test. I know that the VA typically will do TSH on everybody. So during your annual physical, that's just a routine test that they typically do. Yeah,
that's good. They're running, that past as well. In case anything is elevated, or what if there was not a lot of TSH in the bloodstream? Would that be problematic?
Right. So they'll do the T4 and T3, and there's all these different thyroid measures that they do. So they will check all of those.
So they're looking for the right amount.
Correct.
If they saw nothing, that'd be very problematic.
And then they'll compensate. No, you have some TSH in your body, so there is a normal level, but they'll look for the hypo or hyper, whether it's over or under, and then treat accordingly. So
I appreciate the information this morning.
Yes, thank you so much for coming in. Kind of telling us these differences and what people can look for.
Yeah, it's amazing how much it affects different parts of your body. It's very important.
Yes, well, thank you again so much. And coming up, we have what's trending, including